Germany's COVID files have just been released, but they're heavily redacted. This has led to a public outcry from Germans who are demanding to uncover the secrets of the decisions made that shape their lives for years. Should the lockdown files be opened, or should we avoid revisiting what some people now see to be ancient history? Joining me now is Dr. Jay Bhattacharya and Dr. Sunetra Gupta. Jay, I'll start with you. As the world seeks to close its chapter on COVID, there's still a lot of questions to be answered. What do you make so far of different countries' attempts to learn lessons from the pandemic?
I think the most important lesson is to be learned from countries like Sweden that followed a much more moderate path, something much more akin to what was followed during the previous century of pandemic management. They had a lowest all-cause excess deaths than all the rest of Europe, certainly much lower than the United States. The key lesson to be learned is to learn from countries that succeeded, like Sweden.
But Sunetra, it seems a lot of countries simply don't want to learn those lessons. We have a piece in the magazine this week about how much has been redacted from the files coming out of Germany when it comes to how they handle the pandemic.
Yes, it's very unfortunate because I think there is something to be learnt just from a sort of very cursory, if you like, inspection of how countries came out on this. Now, it's important to avoid the kind of league table mentality of, oh, we won, we didn't. And it's really crucial that we dig into why Sweden did as well as it did. So it's very important not to just say, oh, well, we won, ha, 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 or they didn't, or whatever it is. In the same way that, before people were saying, oh, look at Sweden, cautionary tale, eh? And these are very superficial things. Having said that, I do think just a sort of cursory inspection, as I said, of how countries did does give you a sense of what absolutely didn't work. What we need now is some thoughtful, critical thinking and some scientific, rational work to be done to pull out why Sweden did as well as it did. In my opinion, it's because Sweden basically instituted a policy of individual risk reduction while avoiding the costs of lockdown. So it's essentially a focused protection, as we called it in the Great Barrington Declaration.
Jay, even before we get into learning lessons for, I hate to say it, the next pandemic or what could come along next, there has to be some kind of transparency about what happened in the past few years. And that's what's happening in Germany. Our piece for the magazine this week focuses in on redacted documents from the Robert Koch Institute, which was doing a lot of the modeling and a lot of the advising around the pandemic. Understandably, people want the details of what was happening. That's got to be the bare minimum before we even begin to talk about lessons learned and what would happen next.
Absolutely. I've been following the RKI file story very closely. Even with the recent revelations, there's still quite a bit of redactions in those files. And of course, there were just previously in the UK, there was Matt Hancock's WhatsApps, which were leaked, but large part still suppressed. In the United States, the NIH has not been forthcoming at all with their deliberations. In country after country after country, where there was failed COVID response after failed COVID response, what you're seeing is effectively a cover-up of the decision-making and the reasoning by government scientists and their advisors to essentially say, look, you, the public, which suffered through lockdowns, which suffered through school closures, which suffered through business closures, who suffered through massive civil rights violations at scale, you don't get to understand how we were thinking, why we were making the decisions we were making. You just have to sit there and take it. I don't think that's consistent with democratic governance, and I'm looking forward to full transparency. And I hope that the UK COVID inquiry and other similar investigations actually does give the public an insight into what was happening at the time, and so that we can never have it happen again.
But Sunetra, transparency isn't just about having an inquiry, staging an inquiry. It's about actually digging into the details that matter. One of the major criticisms of the COVID inquiry in the UK so far is that it's been all about gotcha moments. It's been about WhatsApps and rude comments made by one MP to another. It's not really digging into the big questions about when lockdown happened, why lockdown happened, how those decisions were made, why the suspension of civil liberties was so easy and went on for so long. Those are not the headlines that are coming out of the COVID inquiry so far.
That's right. I was going to say that, of course, full transparency is almost essential, but it's also very important not to get stuck into who said what and who called whom Dr. Death and all of that stuff. We need to consider critically how the decision-making process allowed this to happen, how it allowed the suppression of dissent and of other, or indeed of the normal response, the accepted response to such a situation was thrown out the window. And how did that happen so quickly? Well, I mean, there is a political analysis that needs to happen alongside, but the nature of that political analysis has to be through transparency of documents and discussions rather than to, oh, wasn't it awful that you called somebody a fuckwit? I mean, that's really not helpful.
Jay, it wasn't just Sweden that did well in comparison to other countries when you look at excess deaths throughout the course of the pandemic. Other Scandinavian countries did pretty well too, and they took different approaches to lockdown. Some were much more heavy-handed. Is it so simple as to say that we can reject the lockdown consensus? Do we have to be a little more nuanced in our discussions and our debates about what happened and analyzing the situation and say, actually, different methods may have worked better in different countries? And the issue with Germany is not its policy per se, but the fact that it has redacted so much information about how it came to its policy?
So first, I agree with you and I agree with Sunetra that the ultimate analysis, the scientific analysis of why some countries did better or worse, is going to end up being somewhat nuanced. I think that the importance of Sweden is that it's a demonstration that lockdowns were not a necessary or sufficient condition to have a good outcome. It's not that that a laissez-faire policy is the right policy in the face of a pandemic. Obviously not. Many people accused the Great Barrington Declaration of being a let-it-rip policy, but it was actually not a let-it-rip policy. It was a policy aimed at marshaling resources to protect the most vulnerable. And different countries did some of that better than other countries. I highlight Sweden because it had such good outcomes without the lockdowns. But Sweden also made mistakes, right? They sent in the Stockholm nursing homes early in the pandemic was a tremendous mistake, sending COVID-infected patients into those nursing homes, managing those patients very poorly. And I agree with Sunetra entirely. We need to have a nuanced discussion of this. Devoid of the mudslinging and the attacks and the smearing and the absolutely terrible destruction of the careers of scientists that spoke up against the lockdown consensus. But I do think that all of that needs to be on the table, and the sort of the air cleared out and all the documents available, and then I think we can start to truly understand what worked and what didn't work.
I think it's important to try and to break it down into: did lockdowns work to stop the spread? And were countries able to avoid the costs of lockdown? What Denmark was able to do, or other Scandinavian countries were able to do because of state support, was to reduce the costs of lockdown. So I think that's where the difference lies, is that all of those countries, because of their more advanced social care systems, were able to avoid the costs of lockdown. Whether they instituted lockdown or not sort of falls out of the equation, because the lockdowns didn't actually do anything to avoid the spread of the virus. That would be my analysis.
Sunetra, a lot of people would dispute that. They would say that lockdowns did work not to eradicate the virus by any means, but to suppress it, especially in countries like the UK, where you have a national health service. You had to try to keep those infections low. I mean, that does remain a heavily disputed point. And there's also the question of a voluntary lockdown. I mean, not all lockdowns are created equal. Many people have argued that one of the reasons Sweden was more successful is because they were voluntarily suppressing the virus. People weren't out and about having parties in March 2020. They were still choosing, broadly speaking, to stay home. But their laws allowed for that flexibility that we did not have in the UK, we did not have in many places across Europe.
Yes, I'm afraid I simply do not buy the idea of a voluntary lockdown, because I don't think there's any evidence, again, on, this needs to be explored further, that lockdowns achieved their stated aim of blocking the spread of the virus. I think they had a very small effect on reducing transmissibility, which worked against the endemic diseases. So flu dropped out temporarily, but for that sort of tidal wave of an endemic disease, endemic infection, it did very little. And of course, there are analyses now underway to test it. But I will say that we did test it in the UK when we opened up, because up to that point, there were two competing hypotheses. One was that all the sort of peaks and troughs we saw were due to lockdowns, voluntary or involuntary, otherwise. And the other extreme was that most of the heavy lifting was done by herd immunity in the context of seasonality of infection. And both can equally explain what happened up to the point where we opened up. Now, if it's all lockdowns, voluntary or otherwise, had been correct, then at the time we opened up, we would see what was predicted by the Imperial College group and others, that would have come to pass, which is you would get this massive exit wave. That didn't happen. So in any case, the parsimonious explanation is that any of the patterns that we see anywhere can be explained by the buildup of herd immunity in the context of the seasonality of transmission.
I found it very interesting that a federal court ruled earlier this month that the Biden administration coerced social media sites to center lockdown skeptics such as yourself. I mean, you must be quite pleased with that ruling. It also reminds us that what we were told was an acceptable or unacceptable opinion to have during the pandemic has shifted quite dramatically because we've been able to look at that international evidence.
So a couple of things about the effectiveness of lockdowns. I actually published a study earlier in the pandemic comparing the policies of Sweden and South Korea, which didn't close schools, didn't close businesses, versus neighboring countries. It's very hard to find any evidence that it actually did slow the spread of the disease, even in March, April 2020, when the lockdowns were most draconian. They spread very, very similar. The waves were very, very similar. And you might ask why that is. I think a fundamental contributor to that is that we think about lockdowns as some monolithic thing where everyone is equally capable of staying home and staying safe. But in fact, the reality of our societies is that they are tremendously unequal. That it's only a relatively small fraction of our societies have that luxury to stay home and stay safe, whereas large numbers of people essentially have to go about their business, or else they can't feed their families. They can't get on in life. I talk about lockdowns as trickle-down epidemiology for that reason. It's essentially a classist policy aimed at protecting a relatively small fraction of our society, the richest, most privileged parts of society, at the expense of the rest. And so now onto why we had this response and why we were not unable to, dissident scientists were unable to mount a counterattack effectively. That federal court ruling, actually, I'm a plaintiff in that case, and in that case, what we found was that the U.S. federal government systematically went to social media companies and coerced them to silence and censor COVID dissidents like me, like Sunetra, basically almost anybody who spoke up against the COVID government narrative faced this kind of censorship and smearing attacks. The U.S. federal government was actually a primary player. They would go to social media companies and say, here are the themes we want censored. Here are the ideas we want censored. Here are the people we want censored. And what the federal court found, the lower court, when they looked at this evidence, they essentially characterized it as a ministry of truth. It's a massive censorship campaign launched in order really to protect the government policy from criticism by effective criticism from outside scientists.
Another question I want to ask both of you is about the vaccine. So it's quite interesting that in these German files, so much of what's been redacted is about the vaccines. Now, I know both of you have a lot of skepticism around lockdown, but the vaccines are a different story. The vaccines worked. The vaccines have saved millions of lives. Why so many redactions in that area?
Well, yeah, there are questions about the vaccines that are important and still outstanding, right? So, first, how good are they at stopping people from getting and spreading COVID? That's a vital question because the policy of vaccines included vaccine coercion. You weren't allowed, put vaccine passports, so you weren't allowed to engage in social life. Many places you weren't allowed to have jobs if you didn't have the vaccine. And that at least a necessary condition of that is the vaccine stops people from getting and spreading COVID. How early on did these officials know that the vaccine doesn't stop you from getting and spreading COVID, and that you can have the vaccine and still get COVID? The other aspect of the vaccines is that, just like any medical therapy, there are side effects. There are populations that suffered from side effects from the vaccines. Young men, specifically with the mRNAs and mRNA vaccines and myocarditis, for instance. When did the officials know that was the case? When did the earliest evidence come up for that? Did they issue appropriate warnings, or did they continue to persist in arguing that the vaccines continue to be adopted by populations where they knew that there were going to be high side effects? Did they suppress open discussion by people affected by these side effects so the patient groups couldn't support each other? That evidence came out that did happen in the United States. That the federal government essentially suppressed Facebook groups, patient groups that were patient support groups that were comparing notes about their vaccine injuries for myocarditis and whatnot. So I think those kinds of questions really do need to be answered, even if the vaccines on net had a net positive effect.
And the key point there, Sunetra, is honesty with the public. You still want to be honest with people about, to Jay's point, what the side effects might be, or to that broader point, what is this actually doing? It's protecting yourself probably from going to hospital, but it's not necessarily going to stop the spread of the virus. That information was quite crucial, especially when it came to public policy around vaccine passports. The whole idea behind them, the underpinning of the idea of essentially a biomedical ID card, was the idea that vaccines stop the spread, they stop the transmission, and that wasn't the case.
This is really a fundamental point that applies across both vaccines, pharmaceutical interventions, and non-pharmaceutical interventions. What it does to the individual is different from what it can achieve at a community level. And this is what people still find it difficult to get their heads around. So, sealing yourself off in a room can protect you, but those NPIs, those non-pharmaceutical interventions, do not appear to stop spread, in my opinion, or it's very difficult to prove that they do. And it's the same with vaccines. If you're vulnerable, the vaccine can protect you against severe disease and death, but you can't roll out the vaccine to stop the spread in a population. And that's where people went wrong. And I suspect it is a sort of embarrassment that also is, manifest in these redactions, which is that most governments got it wrong. They thought these interventions could actually solve the problem at a community level, and this was incorrect, and furthermore carried costs. We know that lockdowns carried enormous costs at community level, and vaccinating everyone in the community achieved nothing in terms of stopping transmission. And of course, the side effects became evident, and it is difficult for any of us, I should imagine, to accept that some people were suffered adverse consequences and even died from taking the vaccine when they didn't need to.
Jay, I think there are a lot of people out there who aren't going to be terribly judgmental about how their government handled COVID. They understand that decisions are being made very quickly. It really isn't about going back and figuring out if people got every single decision right when they had so little information, but rather over the course of almost 2 years, when you did have more information, what did you do with it?
Entirely correct. I mean, I think the issue is the one of a process for incorporating new information as it comes forward. Government bureaucrats, the government scientific bureaucrats that were advising governments, they closed themselves off from the possibility of hearing outside information. That they had a kind of groupthink, which absolutely shocked me to see from the outside, and I never thought was possible of public health bureaucracies that I've dealt with through my career. And yet, that's what happened. The public deserves better. We need significant changes to the kinds of decision-making processes that we saw. Certainly transparency is a necessary step, but I think once we have that transparency, it's going to lead us to wanting a number of reforms that are going to protect us in the next pandemic much better than, and will fare much better than we did in this pandemic.
Sunetra, to Jay's point there, the science isn't generally speaking supposed to be settled on much of anything. You're supposed to keep questioning, keep asking, is one of the issues that governments stopped asking questions actually quite early on into the pandemic.
Yes, it is extremely unfortunate what happened, and it needs considerable reform because, the same thing will happen with respect not just to other future pandemics, but just other crises. I mean, all crises require this sort of the openness, the government, which is really ourselves, to different types of opinion. Because most things are complex. There isn't just one monolithic way to deal with any crisis. But at the same time, I think judgment is perhaps not the right mode of achieving this. Partly because it's unproductive anyway, and secondly because people are never going to say they're sorry. No one has apologized about being wrong, even where being wrong has had such disastrous consequences.
The closest we've gotten in the UK to an apology is people saying they should have locked down sooner. That tells you a lot of what you need to know.